project about the spillover effects of offspring on parental health and longevity that is part of Family Size Matters, which was my ELSA project. And I'll say a little bit about that first. So this was the funding for that has now come to an end. This ran for 5 or actually 6 years, a bit longer because of COVID. And this was a ELSA project that, to be honest, was way too big. And this was because when I applied for it, I thought, oh, you need one small, brilliant idea. And I didn't have one small, brilliant idea. I had a lot of kind of one specific brilliant idea. I had a lot of kind of small papers that I thought I wanted to connect. And the theme that connected them was how family size matters for inequalities. And the idea, the overarching idea kind of being that we have lower fertility over time, and that lower fertility may be important for the quantity, or translates at the micro level into the quantity and the quality of offspring, of children. And that may be important for all kinds of socioeconomic outcomes and well-being, both of the children and of the parents of the children. And the aggregate of that then translates into social inequalities. So I used this logic to kind of sell a bunch of different papers that I thought on their own might not be sufficient for a project. In hindsight, a tip for when you write these proposals, it's probably good to go with small. In hindsight, I wish I'd made it smaller. But we had a lot of fun, and this project falls within the quality of offspring idea. So there's a lot of literature about sibling size and how many children, both as an input and an output. But here we're interested in who the children are, and specifically their educational level, their socioeconomic resources, and does that matter for how their parents are doing? Usually, I would say when we look at outcomes of individuals, we look at how the socioeconomic background of the parents is important for children. And so this is the other way around. How is the socioeconomic background of children important for their parents? What I'm presenting is teamwork with these people mentioned here. So they worked on the Family Size Matter project in different ways. Patrick Prague, who's now in Paris, Cecilia Potente, who's now in Zurich, and John Madia, who's now at Health Economics in Oxford. And the first study that I'll talk about, we actually published. It came out in March this year in the Journal of Health and Social Behavior. And you'll see that the titles are quite similar because we're trying to replicate our own work, which is also an interesting experience to try and replicate your own work. And the second study that I'll talk about is the one with John and Patrick that is still under review, or we're waiting for reviewers to finally get back to us. So any comments and suggestions you have are still very relevant because we will be revising this. So what's the idea of spillover effects? Kind of the general idea of spillover effects of education is that we know that people with more education have all kinds of things in life better, they live longer, they have all kinds of usually positive outcomes, a bit more than people with less education. And this might be something that, you know, is due to selection. These are different kind of people with different resources, but to some extent it's also that education gives you a very flexible set, or indicates that you have a very flexible set of resources that help you with all kinds of things in life. And the spillover is that this might not only help you improve your own life or deal with adversity in your own life, but you may also help others, or it may have effects for others. So spouses, for instance, siblings, And here then in particular, we're interested in whether for adult parents, is there a spillover effect from their children? That's when when you think about it at the micro level, that's why it's relevant. You can also think about it on the kind of macro level. We can only invest, every euro once. So if we invested in young people's education, does that mean that only that generation benefits? Shouldn't we invest it in older generations? A spillover effect would actually say that such a binary view of generations may not be useful if there are spillover effects of education of younger generations for older ones, then actually investing in the young generation has some benefits for the older one as well. So there's a kind of the bigger question in the background as well about investing in different generations. One of the starting papers for us was a 2014 piece in Demography by Friedman and Mayer, where they showed that children's education had really quite remarkably large effects on the life expectancy of parents. So they compared parents where all the children had college education to parents where none of the children had high school education. So quite a big gap. And their model suggests there's a 2-year life expectancy difference between those parents. So 2 years life expectancy or 2 years life, that's a lot. That's a big effect. And they report this, first of all, association and strong effect and rather large effect. So there are some indications that there might be spillovers. So how might these spillovers work? What might be the underlying mechanisms for such spillovers? And there's basically kind of 4 different types of hypotheses that people have put forward. Now, we won't be able to test all of them directly, but by looking at cause-specific mortality, we may be able to say a little bit about some of these. But just to give you an idea of what have people been arguing that is relevant, is at first that it might lead to better health behaviors, and I mean better health behaviors of the parents. So if you have higher educated children compared to lower educated children, that may translate into positive health behaviors by the parents. And the reasoning is that these children may help or inspire or force or facilitate their parents, for instance, to quit smoking, to drink less, to exercise more, and that's because they will do that more themselves, as part of the socioeconomic gradient, and that might spill over to their parents. They may also, this is the second, so that's kind of behavioral pathway. The more material pathway is that these children will be better off in terms of financial resources, material resources, and so they may be better able to help parents, to support parents in these ways. Now, that's particularly relevant in societies where there isn't universal healthcare, perhaps, or where there's more poverty in older age. But you can see that this might help to support parents in dealing with preventing and dealing with health issues. Another quite frequent idea is that children with higher education are more likely to have all kinds of healthcare related jobs, or through their jobs have healthcare knowledge, health knowledge, and access to healthcare. So they're more likely to be nurses and doctors and skilled carers, etc. And that might directly have an effect on the parents' health as well. And then finally, there is this idea that the well-known and quite common social gradients in stressful events might impact on the parents. So for parents, it's stressful if your children become unemployed, if they divorce, these kind of generally seen as negative life events. And in many cases, there's a social gradient in these. So the chances that your children go through such negative life events are higher when they're lower educated, and they're smaller when they're higher educated. So one other route in which the well-being or the health of parents might be affected is that higher educated children cause less stress in this sense. Now, you can, of course, there's counter arguments of why it would work differently. Higher educated children are more likely to move away and not live close by, etc. But this is one of the pathways that has been proposed. And then there's all kinds of stuff that we don't know. There is bound to be unobserved heterogeneity differences. This education of these children is not random, is correlated to all kinds of characteristics of the parents that we don't measure or maybe don't even know. The environment of the parents, it could be genetic, could be environment, could be anything. And so that's a serious problem when we try to assess, this association, and something that if we want to make claims of a kind of a causal effect, that it's really the education of the children, the differences in the education of the children that is driving differences in health and longevity among the parents, is something that we need to take into account. And that's one of the main aims of these two studies. So what do we already know? I showed you the Friedman and Mayer paper, but it wasn't the first paper, but it was kind of the first one in sociology and in demography that was very visible. There's been a review paper in 2017 by the Neve and Kawachi that at that point had counted 10 studies, but as you see in this figure, which I should have updated, but haven't. There's a steep increase in the number of studies. So it's a topic, and they're all about these adult children education on their parents' longevity studies. And so there's been a real increase in these, which is a good thing, but there's a couple of issues with them. First, they only talk about a handful of studies, mostly to do with data availability. So US and Sweden and China are very prominent, and most of the studies come from those places. So it seems sensible to try and add more, especially because we think this might really play out differently in different countries in different settings. More importantly, most of these studies are associational. So we here show the number of studies that are purely based on regression without a kind of causal design in the data, which is the vast majority. And then there are a few that use educational reforms to find some randomness in education to see how that affects the parents. And another design that is used to get at some of the unobserved heterogeneity is using cousin fixed effect. So if you compare the education of, the education of cousins, you can get at something like as a general family effect, and you can try to control for that. So although there's a growing number of studies, they show that all show that there are these associations. almost all use just control strategies and are associational. These studies all report kind of significant findings. They find that parents of better educated children are happier or live longer. I'm not sure to what extent this is, because it's just more difficult to get anything published if you don't show that. I don't know if I suspect there is a publication bias. Just a couple of examples of these studies. So the ones with the reforms, and I show these because we're particularly interested in trying to isolate some kind of causal effect. And if you think about educational reforms, then it's often countries that had recent educational reforms that are developing countries or low-income countries, with relatively low levels of schooling and relatively high mortality still among parents. So, to what extent these examples translate to European settings, for instance, is questionable. But they're still, I think, they're good examples of how you can use school reforms. And they all find that, if populations or new birth cohorts are assigned extra education or get extra education, that seems to have an effect either on the survival of the parents or on specific health indicators. So the Chinese reform, for instance, with smoking and drinking, there it didn't find the differences of those behavioral pathways, but they did find effects on cognition and lung function and other outcomes. And then a couple more, and the one that I think is particularly interesting is the third one here, the Lundberg and Malaysia study on Sweden. And so there were reforms in Sweden in the 50s and 60s, and they find a very specific pattern where not all parents benefit from their children having more education, but it's particularly fathers who benefit if their daughters have more education. And this, in a way, kind of fits with the literature on family and health, where it's often the health kind of carer and health role in a family, so to say, is often a female role, the person responsible, most involved in the diet of people in the family, but even in making appointments to see the GP and the dentist and things like that is there's a gender difference in these, and those are very often the mothers. We know that the health effect of, for instance, losing your partner is larger for men than for women, and again, this idea that these men are not used to looking after themselves so well. And so that fathers benefit more because they would do less themselves. They need more support, or help for them is more effective than for mothers. That kind of fits with some of the ideas that we more generally have, I think, in thinking about families and family gatekeepers and health roles. And also, of course, that Swedish cohort maybe is more like the UK cohorts that we're going to look at than the Mexican or Botswanan cohorts. So I'll get back to the gender differences a bit later. So we'll look at the UK case for England and Wales in particular. And we'll use the two reforms that you can see here on this slide. On the x-axis are birth cohorts, and there were two reforms, one in 47 and one in 72. And what you can see is that they affected the school leaving age. So there's this dotted line or dashed line. I don't know if you can see my mouse if I do this, but anyway, there's this dashed line that is the percentage that leave school at age 17 or later, and that kind of increases slowly over those cohorts, as you would expect, and has happened in many countries. It's educational expansion. But if you look at the more specific ones of how many children leave school when they're 14, 15, or 16, you see two very clear jumps. When the 47 reform came in, pupils had to stay in school for 1 year longer, from 14 to 15. And so you see a big jump in the number of pupils who do stay 1 year longer. And the number of pupils who leave before they're 14 really plummets from high 50s to less than 20%. So that first reform is a big change. And then the second reform in 72 is slightly smaller, but still quite a clear jump in the blue and what's it called? Purple line? Can't remember my colors suddenly. And those two, those jumps are a bit smaller, but that was a reform where you had to now leave school 1 year later at age 16. These reforms were, both of them were planned much earlier, in 44. The first reform then came into place quite quickly in 47, because it's such a big investment and such a big thing. That second reform, that additional year, only happened in 72. But it means it's something that actually, parents have very little control over when it happens, and it happened universally. So suddenly, if you are born on the last day of August, you can leave school when you're 14, or for the second one, when you're 15. If you're born on the 1st of September, you have to stay 1 year longer. So in the UK, the school years are by 1st of September. So that's the cutoff. And this introduces this idea of random differences in educational attainment. So we don't believe there is anything different about somebody who's born on the 31st of August compared to somebody who's born on the 1st of September. And we don't really believe that parents can time this when exactly their child is born. Also, this is something that matters when they are 14 or 15. When parents were pregnant or trying to become pregnant, they didn't know that this reform was going to happen 15 years later, right? So there's no anticipation. So in that sense, it's really kind of random. And the closer we are to those two cutoffs, we think, what is different? Of course, if we look at those 2 days, then we don't believe there's anything different between those kids. Let's take them half a year before and after. Well, there still isn't too much really different about them. The wider you make this bandwidth, or this window, of course, then these children are going to be different, because the environments they grow up in are different as well. And so to some extent we can take that into account. But it's that randomness in the likelihood of having more years of education that we're going to use. And now in the first in the first study, we look at the census data. There was this one question that I copied here for you, where all women were asked how many children they had and when they were born. Now, that's not much information, but for this design, it's really actually all we need to know. We just want to know, was your child born just before or just after the cutoff? And we would then expect that mothers and also fathers whose child was born just after the cutoff, their child is a little bit more likely to have some more education. They should live a little bit longer, if there is a spillover, than those born just before. And the reason to use the census data is that we have a lot of cases, and the census then follows these individuals, so the parents, and we know when they die, and we know the the cause of mortality. And also in the census questionnaire that people fill out once every 10 years here in the UK, there are some subjective health questions, so we can also look at those. So the advantage is that we can follow parents for a very long time. We observe their mortality, we know what they died from, and we have a relatively large sample. The downside is we only know the birth dates of the children. We don't know if they're a boy or a girl, and we don't know their actual educational level. And this means in modeling terms that what we're observing is an intention to treat effect. We know that you've been exposed to the reform, but we don't know how much of the education you took up. But on average, those exposed to the reform will have had more education than those not exposed to the reform. So if there's a strong effect, we would expect to find one, and it would be a random, it would be a causal effect. Now, we first looked at whether there's some evidence that there simply is an association, and we used the 1958 birth cohort for this, which is one of these big UK follow-up studies. And what you see here on the left hand for mothers and on the right hand for fathers are simply the hazard ratios comparing children with more education. The effect of school leaving age with and without controls. And you see that the hazard of dying is reduced and significantly reduced both for mothers and fathers, a bit more here for mothers than for fathers, both with and without controls. So this kind of corroborates the overall findings that yes, there's an association, but what we really want to know is, does this association hold if we try causal analysis, if we try to identify the causal effect, because this could be driven by all kinds of unobserved factors. And we can control for quite a bit here, but it's still limited. Now, this cohort is way too small to use the and they're almost all born. They're also born after the reform, so we can't use this. So this is just to illustrate. Yes, there is the association. Then, when we look at the regression discontinuity design, we hope to see a kind of a jump in the proportion of parents who have died around that threshold. Like we saw that jump when the reform comes in education. Do we see a jump, a discontinuity, when we look at the survival of parents? And so these vertical lines is exactly when the birth cohort, when the reform hits the birth cohort. So on the left-hand side, they had less schooling. On the right-hand side, they had a bit more schooling. What you can see is that already for those birth cohorts, the proportion of mothers who died was going down. So that means at the moment we last observed them, those mothers are still alive, and that just is a kind of the general increase in longevity that we would expect. But we can see a small jump around the time of the reform, not so much very clearly for mothers. So there's a small jump. So the proportion who is deceased goes down and down and down the later the children are born, and that's what we would expect. But then there is a bit of a jump once we get to the reform, and this is a lot clearer for fathers. Here there really seems to be a jump. This is just a visual inspection when we put this in an actual model. How much of this it still remains, and is this clearer for certain causes of death or for the gender of the children. So here what you see is for mothers and fathers, the estimates for the causal effect based on this discontinuity for a whole series of outcomes. First, overall death, which is the first one that I showed in this figure. And although it's a negative effect, you can see that it's not statistically significant. So we can't really say that, that there's an effect there. We then looked at whether it's death before age 65. Maybe children's education is particularly important for early death. There's no evidence for that either. Preventable death, and we recoded causes of death by things that are preventable. And so there are, standard ways of recoding causes of death. Some things are more preventable than others. We don't find anything there. Lung cancer, maybe if those higher educated children persuade their parents more successfully to quit smoking, or they help them quit smoking earlier, then that should have an effect on lung cancer. We don't see an effect for that either. Liver disease linked to drinking. There's a very small effect there that fathers seem to have a lower risk of dying from liver disease. But if you look at this whole picture, it's only the red ones that are significant. And I think it's a bit dangerous to cherry pick and say, oh, we found one effect that, although it fits the narrative, I can't really convince myself to say, okay, this is the one big finding. We looked at heart disease, accidents and suicide, and then those last ones, the long-standing illnesses and poor self-rated health, those are the subjective questions that the parents answered in the census. And there we don't find anything. So overall, we find quite small effects, not always, often, but not always in the expected direction. They're not significant, certainly not if we correct for multiple testing. And then we don't know if their children are male or female, so we can't see if this, daughters have a bigger effect on their fathers than the other way around with these data. But we know something about the parents. So this is for all parents. Maybe if the parents have enough resources themselves, it doesn't really matter who their children are. And so maybe we only see this if we look at parents who have less income, live in more deprived neighborhoods, etc. And so we cut the data in different ways and stratified it by SES, but we find basically the same results. So we really did our best to find something, and there wasn't. So we conclude that children's education is associated, as I showed with the cohort study, with parental longevity, but we don't really have strong evidence, I would say, for a causal effect. Now, that's what does that mean? Why do we find the association but not the causal effect? It could be that these intention to treat estimates that we have are just too conservative. We only see if they're exposed to do a reform, not if they actually have more education. It could also be that this reform, remember, this was the one where you have to stay from age 10 to, from age 15 to 16. So roughly, do you get 10 years of education or 11 years of education? Maybe that difference isn't just so relevant. Maybe there are other points in the education distribution. For instance, do you go on to tertiary education or not, that are more important? Maybe not every, not all educational differences are similar. And so maybe we're just looking at the wrong point or a less important point in the educational distribution. Or maybe these effects that we look at are for all children, sons and daughters, and they could hide that there are sex-specific effects of that we don't see. So we managed to get this published, but we weren't quite satisfied that there were so many unanswered questions. And then we thought we can actually replicate this. With the second study. I see I had a slide about, is this an interesting null finding? I seem to get a lot of null findings in my research. I think I should be a consultant for government. If you want insignificant effects, then come to me, because I'm very good at producing null findings. And I would always argue that a null finding is important, but only if we think it's a strong design. So the question here really is this a strong enough design to say this is really a null finding? And of course, we all know the problem is that weak positive designs you can publish. We shouldn't publish any weak designs, but anyway, if you still find positive effects, the journals are full with them. So we'd argue that yes, this is a strong design and we don't find anything, but that's still important to know. But there are real drawbacks to our design. So we wanted to replicate it because replication itself is important. Also, we wanted to be able to test this specific comparisons. And I showed you there are two reforms, and we only used one, and that was because the first census that we can link is from 71, and so we could only link it to children born in 1957 and 58, and not the earlier design. It was just not possible with that study. But if we had better data, we could possibly do both design reforms, and then if we know more about the kids, we know their sex, but also their actual education, we could move from an intention to treat design to a local average treatment effect. And that's what we did in the second one by using the English longitudinal study of aging, which is every other year asks respondents who were initially aged 50 and older, and were followed until, well, they're still being followed, about 18,000 of them. So again, it's big. Because they start when they are 50, we start to observe their deaths, so we know something about their longevity, and they themselves report about whether their parents are still alive. And then we thought we can actually use this. These people have been exposed to one of the two reforms. Nobody's been exposed to both, but to one of the two reforms, and we can treat them as the children. So we know their education, and because every 2 years they tell us about their parents, are they still alive or have they died? And many of their parents are now of such an age that they are dead. So we can actually do this analysis, and we needed a special license to be able to see when they were born close to the reforms or not. And so we can look at two reforms. We know whether they are a daughter or a son. We know where their actual education. Trade-off. A new problem is that many of their parents have died, but many of them, good for them, bad for us, are still alive. And so we have a lot of right censoring of the parents, and that's something that we then had to deal with. And so what we again do in first instance to see, can we replicate the association? And here again, you can see that yes, school leaving age, the higher the school leaving age, the lower the hazard ratio. Here's shown with the 3 different set of controls. So even if we control for the parents' SES and other things, then yeah, we're very confident that this association exists. But now, what happens when we look at the reforms and do a discontinuity design again? So the problem now is that not all these parents, the problem now is kind of in our outcome. Not all these parents have died yet, so we don't know their longevity. Now, that's fine. Normally, you would just do a Cox regression. But we have to find a way to integrate this with a regression discontinuity design. And what we do is that we first model the survival of the parents in a Cox regression. We then take that hazard as the outcome for the regression design. And we also have a bunch of controls in this case, social class, education of the parents, ethnicity, area of residence, and whether the other parent is still alive or not. And so I go to the results by sex right away. So these are the effects of the causal effect, the causal estimates on the longevity of the parents for sons and for daughters, and for the two different reforms. And so on the left-hand side there are the mothers. Now all the effects are, as we would expect, are negative, so they reduce the mortality. But we don't see a very clear pattern that the daughters, who are in blue, have a larger effect than the sons. So the square ones here are for the second reform, and then the square ones are for the second reform. These are for the first reform, and so here you would see that sons in the first reform, there's no significant effect on the mothers. There's a strong one for daughters, but then the second reform, the sons are quite strong and the daughters are a bit less strong. And when we look at fathers, it's a bit of a different, this is kind of a similar pattern, but we can't make any sense of the gender differences. Now, most of these gender differences are not significant. If you look at the overlap of the confidence intervals, but these differences, we can't really make much sense of the differences, although it's clear that overall, here we do identify a causal effect in the expected direction, with the exception of the sons in the first reform. All the others are as expected. When we look at social class, we don't find anything really. We would expect stronger effects among parents who are working class. And we do find significant effects, the blue ones, working class, as we would expect. And you see huge confidence intervals around the upper class. And that's a bit to do that. It's a bit of a funny definition of upper class. And so we're not entirely convinced that we can really conclude that there are any differences between the classes. But I think what we take away from this is that for the working classes, and they're also much larger, that there are the negative effects that we, and so more education, less mortality, that we'd expect. Is there really no effect for the upper class, which again would fit the idea that if you already have a lot of resources as a parent, you don't need additional ones? Well, that's mainly driven by the big confidence interval. So a bit of a downside of the data here, I think, that it has a small upper class and a strange definition. So we can't replicate the findings for study 1, because in study 1 we found no effect. In study 2 we find actually positive, we find that higher educated children do have a positive effect on the longevity, or a negative effect on the mortality of their parents. We can test the gender differences, but the findings are very difficult to reconcile with any straightforward explanation. So why the sons in the first reform do not have an effect, we don't have a convincing story for that, unfortunately. So what then kind of overall to take, what we take away from this is, well, there is some evidence, and so some, we need to qualify that there's some evidence that higher education in children might contribute to parental longevity, even in high income countries. I think the second set of results is convincing, but we cannot ignore that with other data, with the linked census data and only one reform, we didn't find it. So even though, you know, we think we need to look at the two in together, and so that's why, you know, there is some evidence. We don't really understand well why we do not find it in the first study and we do find the effects in the second study. Of course, the data are different, the methods are slightly different, but we can't get much beyond that. We know, and we try to, you know, look at the data in all kinds of ways. Okay, they are different, but what is it about how they are different that explains why we do or do not find it? That is also for us a bit of a puzzle, and that might suggest that, you know, some of these effects may be, you know, not that large, and so we just want to be a bit careful in these conclusions. Another general conclusion that we find is replication is really difficult, even if you try to replicate your own study. Our experience in trying to publish this made us even more worried about publication bias. And so all those studies I showed earlier on that show the positive associations and positive causal effects, yeah, I'm quite pessimistic about publication bias. More interesting, though, I think, is a question that we really thought about, or we started to think about a lot here is, well, how relevant is education in the UK? And so, of course, the UK famously is a class system, a class society. We haven't been able to look at the causal effect of the occupational class of children. I'm still quite convinced that although a lot of talk about here is about about class, education has such a big effect on class that I still personally think it's really important. But I think it's a relevant question. Is education really that relevant in the UK? In some other countries, many more social economic differences are maybe more directly driven by education than here. And then a final thing is that when you see these kind of studies, or when you do a study on any kind of reforms, you really need to ask yourself, do we know enough about the implementation of the reform? Because we don't use any data on the actual implementation of the reform. We just use the different. We know that the reform happened, and from one year to another year, children had to stay in school longer. But what did that actually mean? What did that year of education look like for those children? Was it really implemented everywhere to the same extent? There's very little literature on it. There are many studies, especially in economics, that use this reform for all kinds of outcomes, because it's a neat, nice reform, and that you can use to get a causal effect of education. But hardly any of those studies actually write about what really happened on the ground. What did these kids do for that year? And maybe in some well-resourced schools, they were ready for the reform. It was a meaningful year. Maybe in some not very well-resourced schools, they were just happy that they were able to keep the kids in school and not make too much trouble for a year. And maybe only after a couple of years, it was it meant something for their education, and it meant that they actually either gained more knowledge or more self-confidence, or went on to more education. And there's surprisingly little literature. And I also have to admit that I was very kind of naive, and we just dived in because, it's such a neat method that we're supposed to use, and only afterwards started to think much more about what do we really know about the reform. So on that reflection, I'll stop, and I'm very keen to hear your reactions and any questions or suggestions.